And we're live. Good morning, everybody. We're talking about a situation that came up with one of my consults yesterday that I want to share with you because simultaneously a new article came out talking about this. My wife and I were talking yesterday about somebody with really neuropathy that has been battling this since going through chemo and radiation to fight cancer. And the neuropathy and the pain has continued to go greater and greater and require more and more medications, which again tend to keep you in a fog. So we do know that there were some nerve ending destruction from the chemo. We know that that's one of the side effects, unfortunately. So this fellow is dealing with neuropathy, which again, the circulation to that part of the body and the nerve endings have all been, what's the best word, fried. So what do? You know, it's real easy for me to sit back and say, the answer to this thing is to improve circulation to that part of the body. But how do you do that? I'm going to read to you a new study that just came out today from Zurich. And it said, researchers have discovered a certain type of blood vessel cell in muscle that multiplies rapidly upon exercise, movement, thereby forming new blood vessels. Researchers said this is a novel therapy for vascular disorders such as neuropathy. In industrialized countries, the leading cause of surgeons having to amputate a foot or a leg is impaired vascular supply to the muscles, especially in diabetic patients. Now, in this case, it's chemotherapy related, says Dr. De Brock. As a professor for exercise and health at the University of Zurich, she and her team studied how to treat vascular disorders and how new blood vessels form. It's common knowledge that exercise and sport stimulate the formation of blood vessels. That's how a muscle gets bigger. By contrast, very little is known about the underlying molecular and cellular mechanisms. Once we understand these mechanisms, we can work towards systematically improving the blood supply of patients' muscles and the neuropathy that's going on in that area, said Dr. De Brock. She did this study in animals, in mice, using cultured human cells. De Brock and her colleagues have now investigated how exercise promotes the formation of thin blood capillaries in healthy subjects, turning the spotlight onto cells of the vascular wall known as endothelial cells, the inside lining of these cells. They discovered there are two capillary endothelial cell types, which can be distinguished by the molecular marker, and you don't need to know this, ATF4. Moreover, the scientists demonstrated that exercise predominantly stimulates cell division of these cells with high levels of ATF4, leading to the formation of new capillaries. By contrast, exercise does not elicit a direct response to the cells with very little ATF4. That's a critical factor. Because if you chase down that rabbit hole right there and say, like, okay, why would that happen? Why would some people who exercise not be able to have the same results? The answer is nitric oxide. Nitric oxide. How do you know the term nitric oxide? Well, we know it from the little blue pill. Viagra increases nitric oxide, gets extra circulation to certain parts of the body. So if you had a way to increase nitric oxide prior to starting an exercise program, wouldn't that make sense? I'm talking about a prep called CircuCore. CircuCore, prep by Nutritional Frontiers, that has a great way of increasing nitric oxide. Could that alone make a difference to somebody with severe neuropathy? It could. But it may be the first step in getting them to be able to get up and move. God built us to move. And in certain situations where the neuropathy is so bad, you can't even walk. Cells with this protein are primed to quickly respond to an appropriate stimulus, such as nitric oxide, as soon as the person, or in this case, the mice, started exercising, these cells increased their amino acid intake and accelerated the formation of DNA and proteins. Increased their amino acid intake. Step 2 in solving the mysteries of neuropathy. An extra 30 to 60 grams of protein a day, making sure you're digesting it properly, or we're doing it as a drink so that we can get extra amino acids to the source, necessary prior to starting the exercise program. Why these ready-to-go endothelial cells are mainly found near red muscle fibers is not yet known. The researchers intend to unravel this mystery next. In addition, the scientists hope to use these findings to develop therapies to stimulate the growth of blood vessels in patients suffering from diabetes, or in this case, chemotherapy-related neuropathy that caused arterial occlusions, and even in organ transplant recipients. I don't know about you, but I consider that pretty big news. Now, I'm not going to suggest you go about this on your own. If you know somebody that's suffering from neuropathy and is totally frustrated because there's just not been much out there that can make a difference, this may be the answer. And it just came out this morning from the University of Zurich. And I wanted to share it with you and put it here on YouTube right away. I have to be careful what I say on YouTube so they don't ban me. So I'm not talking about COVID today for a change. But anyway, that's what I think. The number, if you want more information, is 678-228-8900 to reach us off air, 678-228-8900. Our website is thenutritionshop.net. That's where you can see our YouTube channel, THE, Nutrition Shop, shop like the old English, SHOPPE. Check it out. A lot of good information there as always, including stuff on COVID. God bless you, folks. Have a great, healthy day, and hopefully you can share this with somebody who may be suffering. God bless.